Welcome. This is Brian Wood, Medical Director for the Mountain West AETC Project Echo Telehealth Program. Each of our weekly sessions starts with a short talk focused on issues relevant to HIV clinical medicine. The following talk was recorded live here at University of Washington. We will now take you to this week's talk.
Hello, everyone, and thank you so much for that warm introduction. Really happy to be with you all today. My name is Nicole Elinoff. I use she, her pronouns, and I'm a senior manager on NASTAD's prevention team. And I do a lot of our technical assistance work around PrEP and PEP. Just wanted to share, I don't have any conflicts of interest to disclose, but I will be talking about our new billing and coding guide, which I helped lead the coordination of, but I did not write the billing guide. So if there are some really in-depth billing and coding questions that I'm not able to answer, I will be sure to get you an answer from our amazing billing and coding expert consultant, Caroline Poiker. So for those that don't know NASTAD, we are an association of public health officials that administer HIV and viral hepatitis programs. And our mission is to advance the health and dignity of people living with and impacted by HIV/AIDS, viral hepatitis, and intersecting epidemics by strengthening governmental public health and leveraging community partnerships. And our vision is a world committed to ending HIV/AIDS, viral hepatitis, and intersecting epidemics. So today, I'm just going to set the stage a little bit about some of the PrEP access changes and challenges that really helped pave the way for the update to the billing and coding guide. And then I'll give a brief overview of the update and what the update includes for the billing guide. Let's talk about some of these changes. So NASTAD originally had a PrEP billing guide that was released in 2016. So as many of you know, there has been a lot of changes in the PrEP access landscape since that time. So since 2016, we had the introduction and implementation of the United States Preventive Services Grade A recommendation for PrEP. There was also the FDA approval of TAF-FTC in 2019. And long-acting injectable cabotegravir in 2021. In 2020, we had the introduction of generic TDF-FTC, and we also had the updated CDC PrEP clinical guidelines that were released in 2021. And so with these changes came a need for more billing and coding guidance, especially as patients still received bills for their PrEP services despite the USPSTF Grade A recommendation. In addition to the changes that I mentioned, NASTAD was also hearing about other billing and coding challenges occurring in the field. So there were many buckets of these challenges that I'll go over briefly. One of the buckets was labs. So as we know, folks on PrEP get, HIV testing every 3 months. And so with the labs, we saw that the first HIV screening was covered without cost sharing. But subsequent labs, patients were still getting a copay for those labs. And so, with the labs, there was just the PrEP lab panels weren't necessarily being flagged and coded as being labs for PrEP. So we had that challenge. There was also no ICD-10 code for PrEP up until October, which I'll talk about in a second. And so a lot of providers were playing billing bingo because there was no right code for PrEP. There was the lack of capacity to manually check each claim to a health plan. Health plans were unclear and had inconsistencies of what billing codes they would pay versus not. So there was just inconsistency across coverage in health plans. Then, of course, there were billing errors, which happened, so services were coded incorrectly. Some codes are stigmatizing, such as the high-risk homosexual behavior code. And then modifier 33 was not being adopted, and clients' employer plans were grandfathered unknowingly, so they were not eligible for, no cost sharing. So many buckets of challenges that our billing guide aimed to help address. This update really took place throughout 2023. We identified an expert billing and coding consultant, held 2 advisory group meetings, another prevention advisory committee meeting through the Federal AIDS Policy Partnership. And then we had a bunch of key informant interviews. We had a request for information, and some providers shared de-identified claims data with us. There was an internal and external comprehensive review. And then the guide was released in October 5th, 2023. So we just celebrated our 5-month anniversary. And in all, we had over 40 individuals contribute their time and expertise, whether it was reviewing the guide, providing data resources, or helping share some of the challenges so that they can get troubleshooted. And this work was supported through our CDC 1906 cooperative agreement. So very exciting. I'll put the billing and coding guide link in the chat, but it is live and was released in October. So the updates really address USPSTF implementation. It also talks about long-acting injectable PrEP implementation, self-testing, post-exposure prophylaxis. It's not on this slide, but teleprep as well, and then troubleshooting claim denials. It's a very comprehensive document. It is very long, but there's so many nuggets of information. So I wanted to briefly highlight some of the new tools that this resource has included, and that, I mentioned the ICD-10 code for PrEP, which we talk about. There's also new HCPCS codes for PrEP. So the HCPCS code we talk in depth about in the guide is the one for long-acting injectable cabotegravir. The tool has some information about payer policies, and then some really great maps and decision trees to help with billing for PrEP, PEP, and teleprep visits. There's in-depth information about both modifiers 25 and 33, and then some denial and appeal tools. Because time's limited, I just wanted to share a little bit about the star of the show, and that's the new ICD-10 code for PrEP. It was effective October 1st, 2023. And this is our code for the encounter for HIV pre-exposure prophylaxis. So this code is not able to be used if it's in conjunction with desensitization to allergens and prophylactic surgery. But the code also notes that if applicable, risk factors for HIV, such as contact with and suspected exposure to human immunodeficiency virus. The code already states pre-exposure, so there's kind of a bit contradictory there. And then it also says, if applicable, to do the high-risk sexual behavior. But as I mentioned, this code's not recommended due to the stigmatizing language. But we have a whole in-depth discussion about ICD-10 code in the updated guide. And we're really hoping that some of the billing challenges that I mentioned at the beginning of this discussion would be alleviated through the use of this code. We also have some information on outcomes. So if the claim was denied with no payment to the provider and no cost share to the patient, we have resources that talk about commonly occurring denials and list different corrective actions. There's an appeal letter template with rationale and supporting resources. And we encourage providers to review payer policies before appealing a claim so they can understand the denial reason. If the claim was paid, but the patient's still receiving a cost share, we have an appeal letter template with rationale and supporting resources. And then we have the PrEP cost sharing complaint template letter resource as well. Then we just say, to confirm that the point is not grandfathered before appealing. So this is a customizable template letter to assist providers and patients issue a cost-sharing complaint. It talks through who to file this complaint to. It's a customizable Word document, so I'll include that link in the chat as well. And there's so much more that can be said about this guide, but if you would like further information about it, we do have the webinar that we did in October that fully goes through the guide, talks through some of those decision trees, and there's an FAQ available as well on that link. And if you have questions or want to get in contact with me, here are 2 good emails for that. And just want to say again, thank you so much for this opportunity and really appreciate the time and space. So thank you.
Thank you for watching this edition of the Mountain West AETC Project Echo Didactic Series. If you like this talk, please click the red subscribe button and please check out other talks in our series. Until next time, this is Brian Wood, Medical Director, signing off.